Prevalence 50%. Nearly 50% of adults aged 40 and older have high blood pressure. And many do not know it, which increases risk of stroke and heart attack. This silent condition often shows no symptoms until damage accumulates. So early detection matters for long-term health. Check your blood pressure with a validated cuff today and record the reading in a notebook or app. For your next medical visit. Age 65. Balance often declines after age 60 due to changes in muscle strength, vision, and inner ear function that accumulate over decades. Recognizing this decline early helps prevent falls and loss of independence in the coming years. Simple exercises can slow decline and improve confidence in daily tasks. Muscle 3%. Skeletal muscle mass can decrease about 3% per decade after age 30, which affects ankle and hip stability needed for balance. Strength-focused balance exercises target those muscles to reduce decline and improve posture and reaction time. Consistent practice over 6 to 8 weeks shows measurable gains in strength and steadiness. Home hazards. 5 home hazards like loose rugs, cluttered walkways, poor lighting, unsteady chairs, and slippery floors increase fall risk for seniors. Identifying and removing these 5 common hazards reduces risk immediately and makes exercise practice safer in the same space. A safer environment supports consistent training and lowers fear of falling. Near fall. Too frequent near falls or feeling unsteady during daily tasks are warning signs that balance training is needed, especially if this happens 2 or more times per month. Tracking these incidents helps you and your healthcare provider decide when to start a structured program. Early action reduces the chance of a serious fall and builds confidence. Validated monitor. Not all devices are accurate, so choose an upper arm automatic monitor that is validated and cuff-sized for your arm, especially if your arm circumference is above 32 centimeters. Proper cuff placement and rest for 5 minutes before measuring ensure reliable readings that guide decisions about treatment. Verify your device accuracy at a clinic once and then use the same monitor consistently for home checks. Proper technique. Sit comfortably with back supported and feet flat. Avoid caffeine or smoking 30 minutes before measurement. And take 2 readings 1 minute apart to reduce variability. Recording time of day and medications helps identify patterns and medication effects on readings. Perform measurements on waking and in the evening for 7 days and log each result for review. Diet. The eating plan emphasizes vegetables, fruits, whole grains, lean protein, and low-fat dairy, and can reduce systolic pressure by about 8 to 11 millimeters of mercury in some people. Limiting sodium to around 1,500 to 2,300 milligrams per day and increasing potassium through food supports blood pressure control without medication changes. Start by swapping one salty item for a low-sodium alternative today and tally your daily salt intake. Sodium 1,500 milligrams. Many processed foods contain hidden sodium, and reducing intake to near 1,500 milligrams daily yields measurable improvements in a few weeks for older adults. Reading labels and choosing fresh or frozen vegetables over canned options helps lower unrecognized salt, and cooking with herbs replaces the need for extra salt. Replace canned soups or deli meats with fresh options for at least 1 meal today to cut sodium. Weight loss. Losing 5% to 10% of body weight often leads to meaningful reductions in blood pressure, with even modest weight loss improving readings within weeks. Combining caloric reduction with increased physical activity is more effective than either alone. And weight loss strategies should be tailored to mobility and chronic conditions common in seniors. Choose a realistic 4-week goal to reduce weight by 2 to 3 kilograms and plan meals and gentle exercises to Support that goal starting today. Exercise 150 minutes regular aerobic activity, such as brisk walking for 150 minutes per week, lowers average blood pressure and improves cardiovascular fitness in older adults when performed consistently. Combining strength training twice weekly helps maintain muscle mass and supports overall health, with modifications available for joint limitations. Begin with 3 10-minute walks this week and gradually increase to 30 minutes on most days. Alcohol drinking more than 1 standard drink per day for women and more than 2 for men tends to raise blood pressure, and reducing intake leads to measurable improvements within weeks. Cutting alcohol supports medication effectiveness and reduces risk of arrhythmias and falls in seniors. Limit alcohol to guideline amounts or abstain this week and track how many standard drinks you consume each day. Sleep apnea. Untreated obstructive sleep apnea is common in older adults and contributes to resistant hypertension due to repeated oxygen drops during sleep. Screening with a sleep questionnaire and referral for testing can uncover a treatable cause of elevated readings that improves with CPAP therapy. If you snore heavily or feel unrefreshed, ask your clinician for a sleep evaluation this month. Med adherence. Medication adherence is a major barrier to control, as missing doses or stopping drugs raises pressure and increases risk within days to weeks. Simple strategies like pillboxes, linking doses to daily routines, and using a single pharmacy improve consistency for people taking multiple medications. Set up a daily pillbox and an alarm for your medication times starting today. Quiz. Quick question. Does blood pressure need treatment if you feel fine? And is home monitoring unnecessary for seniors who visit the clinic regularly? Answer the question in your head or comments to engage with the content and reflect on your monitoring habits. 1. Quiz. Answer. The correct point is that treatment may be needed even without symptoms, and home monitoring adds valuable data between clinic visits, especially for older adults. Use home readings to show trends and talk to your clinician about therapy adjustments if readings are consistently high. Start recording home readings twice daily for 1 week to bring documented trends to your next visit. Target BP for most older adults. A common treatment target is below 130 to 140 millimeters of mercury systolic depending on frailty, medical history, and tolerance of medications, with individualized goals set by clinicians. Lower targets reduce cardiovascular events but require careful monitoring for low blood pressure. Symptoms and falls in seniors. Discuss an individualized systolic target with your clinician and note the agreed number in your health record. When to call. Seek urgent medical attention if systolic pressure exceeds 180 millimeters of mercury or if you develop chest pain, sudden weakness, confusion, or visual changes because these may signal hypertensive emergency with organ damage. For persistent readings above your agreed target but below emergency levels, contact your clinician for timely medication review within days to weeks. If you record a reading above 180 millimeters of mercury or new severe symptoms, go to the nearest emergency department immediately. Med side effects. Common medication side effects include dizziness, lightheadedness, cough with ACE inhibitors, and electrolyte changes with diuretics. And older adults may experience more pronounced effects due to kidney function or interactions. Monitoring labs and blood pressure after starting or changing doses helps detect problems early and guide adjustments. If you notice new dizziness or cough after a medication change, call your prescriber within 48 hours for advice. Drug interactions. Over-the-counter pain relievers, some supplements, and herbal remedies can raise blood pressure or blunt medication effects, with NSAIDs being a frequent culprit in seniors. A complete medication list including supplements helps clinicians spot interactions and prevent avoidable blood pressure increases or side effects. Bring every medication and supplement bottle to your next visit and ask about interactions. Specifically, timing of blood pressure medications can influence overnight and morning readings. And some clinicians recommend evening dosing for certain drugs to improve 24-hour control. Changes in dosing time should be clinician-guided and monitored with home readings to ensure safety, especially in people at risk of nocturnal hypotension. If you consider changing the time of a pill, consult your provider and record readings for 1 week after the change. Monitor frequency after initial diagnosis or medication changes. Home monitoring twice daily for 1 week each month helps detect trends in treatment response. While stable patients may reduce frequency per clinician advice, regular logs enable dose decisions and reduce dependence on single clinic measurements that can be affected by white coat effects. Commit to scheduled monitoring weeks and bring the log to each follow-up visit. Traveling can disrupt medication schedules, dietary patterns, and sleep, all of which affect blood pressure control and can increase risk of elevated readings. Pack medications in carry-on luggage. Set alarms for dosing across time zones. And choose low-sodium meals to maintain stability. Prepare a travel medication list and set travel dose reminders before your next trip. Clinic visit. Bring a written home blood pressure log, a list of medications, and questions to your clinic visit so clinicians can make informed adjustments and avoid unnecessary testing, including recent weight, symptoms, and dietary changes. Gives context for trends in readings and supports shared decision-making. Prepare and bring your log and list to the next appointment to enable targeted treatment decisions. Support system. Family members or caregivers can help with medication reminders, transport to appointments, and dietary changes, improving adherence and safety for older adults managing blood pressure. Communicating a clear plan and delegating specific tasks like pillbox refill or grocery shopping reduces the burden on patients and supports consistent care. Identify one person to assist with medication and care coordination and ask them to help starting this week. Emergency signs. Recognizing emergency signs such as severe headache, chest pain, sudden numbness, or slurred speech enables prompt care and reduces long-term harm from hypertensive crises. Teaching these signs to family members and having an emergency plan with contacts and medications documented improves response speed. Share the emergency signs and plan with at least one caregiver or family member today. Home checklist. A practical home checklist includes a validated monitor, cuff of correct size, a measurement log, a list of medications, and a plan to contact your clinician for high readings or side effects. Having these items readily available reduces delays in diagnosis and ensures you can demonstrate trends at clinic visits for informed decisions. Assemble these 5 items on a shelf near where you will take measurements and start using them tomorrow morning. Daily routine. Integrate blood pressure control into daily routines by pairing measurements with existing habits like morning teeth brushing and evening medication, which improves consistency and tracking. Consistent timing and posture when measuring reduce variability and provide clearer data for clinicians. Link your blood pressure checks to a daily habit and set alarms to maintain regularity starting today. Follow up 4 weeks after a medication change or major lifestyle adjustment. A follow-up within about 4 weeks allows assessment of effectiveness and side effects and prevents prolonged uncontrolled pressure. Timely follow-up enables dose tweaks that can prevent complications and optimize quality of life. For seniors on multiple medications, Schedule a follow-up appointment or telehealth check within the next 4 weeks and bring your home readings to that visit. Final checklist: summarize your plan with a clear checklist. Validated monitor. Twice daily logs for 1 week each month. Reduced sodium to about 1,500 to 2,300 milligrams. Daily activity goal. And medication adherence strategies to follow. This checklist helps you and your clinician see progress and make targeted changes to lower risk of heart attack and stroke over time. Complete each checklist item this week, starting with obtaining or validating your monitor. Call to action to finish. Review the key actions. Measure blood pressure at home. Reduce sodium. Stay active for 150 minutes weekly. Follow medication plans. And seek prompt care for high readings or symptoms. Taking one measurable step today, like recording a week of morning and evening readings, creates data that leads to better treatment decisions and safer blood pressure control. Start by taking and logging your first home reading now and share your experience in the comments. Or with a caregiver. Do one action today and share your result in the comments.